Hello, my name is Barbara Zimmerman. I am a Deputy Director in CDRH's Office of Regulatory Programs and one of the Center's leads in tracking our performance under the Medical Device User Fee Agreement. The Medical Device User Fee Amendments of 2017, or MDUFA 4 for short, cover the period from October 1, 2017 through September 30th, 2022. However, device user fees were first established by Congress in 2002. Medical device companies pay fees to FDA when they register their establishment and list their devices with the agency, whenever they submit an application or a notification to market a new medical device in the United States, and for certain other types of submissions. These fees and the commitments that FDA makes as part of the user fee agreements provide a mechanism for FDA to increase the efficiency of regulatory processes in order to reduce the time it takes to bring safe and effective medical devices to the U.S. market. To help drive that efficiency, a core feature of the MDUFA agreement are the performance goals. The MDUFA 4 agreement includes two sets of performance goals. Review performance goals are objectives for FDA's review of various types of pre-market submissions. The MDUFA 4 agreement was noteworthy, among other reasons, for including performance goals for our review of de novo submissions for the first time. Shared outcome goals are, as the name implies, objectives that both FDA and applicants share responsibility for achieving. Shared outcome goals are intended to reduce the average total time to decision for pre-market applications and 510K submissions, while continuing to maintain standards for safety and effectiveness of the devices. My discussion today will focus on FDA's performance in meeting these goals over the first 3 years of the MDUFA 4 agreement, which, I am proud to say, has been very strong. In addition, because the devices program has faced and continues to face unprecedented challenges in 2020, as we focus our time and resources on battling the COVID-19 pandemic, I will touch on how the pandemic response efforts have begun to affect our ability to continue to meet MDUFA performance goals in certain areas. In total, the MDUFA 4 agreement involves 25 goals, 23 review goals with specific target percentages, and 2 shared outcome goals. This slide provides a snapshot of FDA's performance in relation to these goals thus far. As I said, FDA's performance in meeting the MDUFA 4 goals has been strong. In fiscal year 2018, we have received submissions for 21 of the 25 performance goals. Of the 21 goals where we received submissions, FDA met all 20 goals. In fiscal year 2019, we received submissions for 20 of the 25 review goals. Of the 20 goals where we received submissions, we met the goal for 13 of them. We did not meet the goal for 1 and still have the potential to meet 6 more of the goals. In fiscal year 2020, all submission cohorts are still open except for 1. The 1 submission cohort that has received enough submissions to determine if we have met our goal is for pre-submissions. I am pleased to say we have met our pre-submission goal for fiscal year 2020. You can also see this table without the color coding, but with more details in the MDUFA Congressional Performance Report, which is listed as a reference at the end of this slide deck. This table includes 16 goals which apply to both CDRH and CBER. I have color-coded each of the goals. The goals that are green have met the performance goal. The goals that are yellow mean we do not have sufficient data yet to calculate if we have met or missed the performance goal. We refer to this situation as pending. I will elaborate on this in a minute. The goals that are red mean we have missed the goal. The goals that are gray mean we did not receive any submissions for that goal. And the goals that are white mean we have not yet received any submissions for that fiscal year, or that fiscal year has not yet begun. FDA has done an excellent job in meeting the performance goals listed in this table, as can be seen by all the green boxes and only 1 red box. Performance goals are calculated based on the year each submission was received. We call this a receipt cohort. For example, the performance goal for 510K decisions is for FDA to review a submission within 90 days 95% of the time. This means that for all the 510K submissions received in fiscal year 2018, we will wait until we have made a final decision on almost all of them before we are able to determine if we have met this goal. Until we reach the point where we can calculate if we have met this goal, we indicate that our performance is pending. The first table on this slide lists 7 goals which only apply to CBER. The second table, or the bottom table, lists 2 shared outcome goals. Both of these tables follow the same color coding as I just explained for the previous slide. As you can see, CBER has done a great job meeting their performance goals. They met all their goals for which they received submissions. The shared outcome goals are goals which FDA and industry have a shared commitment to achieve. These are total time to decision goals, where FDA is responsible for reviewing the submission in a timely fashion, and industry is responsible for providing any needed additional information in a timely fashion, such that, together, the total time to decision goals are met. There are shared outcome goals for 510K and PMA original and panel track supplements. At this point in time, we only have sufficient data to calculate the total time to decision goal for fiscal year 2018. We have met both the 510K and PMA shared outcome goals for fiscal year 2018. The shared outcome goal for 510K was to achieve a total time to decision within 124 days, and the shared outcome goal for PMA was to achieve a total time to decision within 320 days. Now I would like to take a few minutes to discuss the EUA and pre-EUA submissions we have received since the beginning of the calendar year. EUAs and pre-EUAs are not part of the MDUFA 4 performance goals, but have contributed heavily to our workload this year. Since the pandemic started in March, we have received over 4,500 pre-EUAs and EUAs. In addition, FDA has issued more than 20 guidance documents related to medical devices as part of the COVID-19 pandemic response. De novo, PMA original, and panel track supplements are contributing to the increase in the number of submissions under review. This is an encouraging sign. It is a signal that the pipeline for innovative technologies appears to remain strong, which correlates with a record number of novel devices for which we have received and issued EUAs over the past few months. As I previously just mentioned, this is a good sign because the innovative technologies remain strong, but it also means the staff have a lot of work on their plate. As you can see, our total volume is significantly higher than it was 1 year ago. It is approximately double what it was last year at this time. While the pre-EUA and EUA submissions are driving the doubling, we are also seeing increased workload in our time-intensive submissions such as de novo, PMA originals, and panel track supplements. The organization's focus is on addressing the pandemic needs before the non-pandemic related work, and then submissions with MDUFA goals over work that is not associated with the pandemic or MDUFA performance goals. It is no surprise that the increased volume of work the organization is experiencing is putting a strain on our ability to meet the MDUFA performance goals. The next few slides are examples of some signs of strain we are seeing in our MDUFA data. This graph is tracking the average time it takes to make a MDUFA decision on a PMA original or panel track supplement from fiscal year 2007 through fiscal year 2019, when each fiscal year's cohort is about 71% closed. Please note, at this point in fiscal year 2020, there are very few submissions which have had a final MDUFA decision. Therefore, that data is not included in the graph. It will be added as soon as MDUFA decisions have been made on approximately 50% of the submissions received in fiscal year 2020. The data on this graph is showing us that the average time to a MDUFA decision is increasing if you compare the fiscal year 2018 and the fiscal year 2019 cohorts. The increase in average total time is being driven by an increase in FDA's review time, the blue line. This increase in average review time for FDA is largely being driven by the inability of FDA staff to review submissions as quickly as they previously were prior to the COVID-19 pandemic. The data on this slide is showing the total number of PMA originals and panel track supplements that are awaiting a MDUFA decision. These are pending submissions, and the number of submissions we have received in each fiscal year. Please note, the number of PMA originals and panel track supplements for fiscal year 2020 is only a partial year and will increase by the end of the fiscal year. As you can see, the number of pending submissions at the present time is greater than it has been in several previous years. So far this year, there is an increase of 11 applications as compared to 2019. The increased number of pending PMA original and panel track supplements is likely due to the inability of FDA staff to complete the review of these applications as quickly as they have been prior to the COVID-19 pandemic. The data on this graph is showing the trend in FDA's 510K decision goal performance. The orange arrow on the graph is pointing to the line which represents fiscal year 2020's performance. it is showing that at 10 months into the fiscal year, FDA is meeting its goal of reviewing 510K submissions within 90 days, 98.8% of the time. While this level of performance is well above our performance goal of reviewing a 510K submission in 90 days, 95% of the time, it is an early indicator that we may struggle to achieve our goal of 95% by the time the cohort has closed, especially if it continues on its downward trend. In conclusion, FDA's overall MDUFA 4 performance has been strong. We have consistently met our performance goals. However, the COVID-19 pandemic has put a significant strain on our fiscal year 2020's ability to meet user fee goals. We will continue doing the best we can to prioritize our work and shifting our staff to the areas which need the most assistance, but we do expect our performance to further decline. As always, our staff remain committed to doing all that they can to support the country's efforts to combat the pandemic while continuing to support our critical non-COVID priorities, particularly those related to MDUFA. I have listed a few resources on this slide which go into greater detail about our user fee performance goals and current progress in meeting those goals. The link to each of these resources is embedded in the slide. Thank you for your attention today, and please stay safe.